Hey everyone, Dr. Charlie Johnson, physical therapist, and I want to talk about the straw that broke the camel's back, okay, as it relates to back pain. So one of the common story that I hear in people who come in and have back pain is that they bent over to tie their shoes, or they bent over to pick up a pencil, or the latest one was they bent over to feed a cat, feed their cat. And they say it's always feeding the cat that does it. And it seems like something so little sometimes that causes your back to sort of go out on you, okay? And while the truth of it is that that's to you what caused it, and sort of the main problem, right, is that that's really just the straw that broke the camel's back, okay? So that was the straw, and that little thing, all right, under ordinary circumstances wouldn't be a problem for you. But there's something that happened way before, and probably throughout the years, or throughout the past couple months, or even throughout the past week, that has predisposed you to having such a simple thing cause a major back problem and your back to go out. Okay, so the traditional story of, in this case, somebody who has back pain and maybe a herniated disc would be that when you dig deeper, so we're going to think about this, when you dig deeper into the history of what these people did before, it was usually something like this, okay? Either that they have a desk job where they sit all day, or in the case of somebody else I just treated, that they had they took a long car ride, from Pennsylvania to Kentucky and back, all in a matter of just a couple days. All right, and then they noticed that their back was maybe a little bit, but what do they remember? Then they remember when they bent down to pick up their car keys, or they bent down to put on their shoes, as the instant when their back pain came on, okay? When the truth of it is there was some type of static loading or prolonged position that predisposed the structures in the back to sort of become weakened, if you will, or more susceptible to an issue, okay? So in that example, somebody's sitting all day, they're driving. If you zoom in on their back, right, they're sort of in a bent forward position. Think of a slinky, okay? Compression on this side and a lot of pressure on the front side, which, if you remember, there's disc material in here, okay? So the disc material is about 80% water, and if you push on the front of it, all right, the disc material will move towards the back. So in the example of someone sitting all day, right, or the long car ride, that disc material is all the way back here. Then when you go to stand, you have a little stiffness, you shake it out. It was just because I was sitting for a while, or driving for a while. But then what happens is the disc has sort of been loaded in that position such that there's already been for a while some pressure on the back here, right? Picture like a little bubble, right? And then you bend forward, and now you've got that same position, except you've got it under load, right? So now you have an issue. So usually there's a sort of predisposing factor there. If you sit all day, if you drive all day, or you just do anything that you're in a consistent static position or contracting the same consistent muscles over and over again, okay? That will predispose you to constantly loading and or contracting the same tissues over and over again and cause stress in those areas. And then you'll have the whole issue, in many cases, of the straw that broke the camel's back. So if you're watching this, you have back pain, unless you've had a traumatic event where you were deadlifting or just picking something up that was like way too heavy or something like that, then yeah, I mean, that could have just been it. But in many cases, when you dig further into what's going on and you think more about what happened beforehand, you'll be able to sort of put the pieces together as to why that was, why your back sort of went out on you. Okay, so if this video was helpful, subscribe for more like videos and or comment and like below. Thanks.